Hello, everyone. I think we have a quorum. Welcome to the webinar. Maybe we can give it 2 more minutes because I see people are still joining, and then we can start. So we can start now. Hello, everyone. My name is Dr. Soy. I'll be the moderator for today's session. And today's session is we'll be discussing alcohol and drug abuse amongst healthcare workers. And I'm a member of the KME Physician Wellness Committee, which is a committee that is concerned about mental and physical well-being of doctors in Kenya. And so welcome to this webinar. Our speaker today will be Dr. Florence Jagug, who is a psychiatrist at Moi Teaching and Referral Hospital. She is in charge of alcohol and drug abuse, of the alcohol and drug abuse units at MTRH. And she is also the chair of the employee assistance program in the same institution. And she's a member of the same committee. So she'll take us through the session. We like to keep it short and sweet. And if you have any questions, you can leave them at the question box and will be addressed at the end of this webinar. Welcome, Doc.
Thank you so much, Christine. You're able to see my screen?
Yes, we are.
Okay. So good evening to everyone, and thank you so much for joining us today as we talk about this very important topic about substance use among healthcare workers. Okay. So we are going to look at how big the problem is, and then talk about why we should care. Should we even care about this problem? talk about what can be done, look at really practical solutions that we can implement to address this problem, and then look into the future. You know, where do we envision interventions for substance use to be for healthcare workers? So how big is the problem? You know, globally, we are seeing that around 1 in 5 healthcare workers, you know, have used substances roughly. In this first study that you're seeing there, we are seeing that the prevalence of tobacco use was 21%, which is really a fifth. That was a number of studies pulled together. And then in the US, there was a study that was done in 2012 that found that 21% of male doctors and 12%, about 13% of female doctors had an alcohol use disorder. Alcohol use disorder really means harmful alcohol use. And then in Germany, about 20% of doctors had harmful alcohol use, almost similar to what was found in the US. And then closer home in Nigeria, a study done in 2018 found that 30% of doctors had an alcohol use disorder. So I know a lot of this work is focusing on doctors, but if you look at the first study, it looked at a broad range of healthcare workers. So what about in Kenya? A number of studies have been done. One that was done in 2016 found that about 35% of healthcare workers had used alcohol. This is just using, this is not harmful use, but just using. 23.5% had used tobacco, and the prevalence for other substances ranged between 3 and 10%. But in terms of harmful use, this study found that the highest was for tobacco at 11.8%, and it was 2.9% for harmful alcohol use. So we are seeing a high level of involvement with substances among healthcare workers, especially if you compare with what is happening in the general population. These statistics are quite high. Like if you look at the prevalence for tobacco use among the general population in the country, it's about 10-12%. Among healthcare workers, we are seeing it as 23.5%. For alcohol, again, use is about 28-30%. In the general population, healthcare workers, you're seeing it's 35.8%. Okay, so we've done work at MTRH, although it has not been published. But what we found was that 42% of staff had a lifetime history of using alcohol. Again, we're seeing that is higher than the rate that is found in the general population in Kenya, which is about 30%. Tobacco use was 7.9, closer to what we see nationally in the general population. Cannabis again was 5%, closer to what we see in the general population as well. So for alcohol, we are seeing that the rate of use among healthcare workers at MTRH was much higher than the general population. In terms of harmful substance use in the past 3 months, we are seeing it was quite high for males. 24% of males had harmful alcohol use, 13% of males had harmful tobacco use, and 1.5% cannabis use. Of course, we can see much lower rates for harmful substance use for women. And really, this is a pattern that's seen almost everywhere across the world, that the patterns of substance use among, the prevalence of substance use among males are significantly higher than that found among females. We also did a study during the COVID-19 pandemic, and we found that 44% of healthcare workers across the country had harmful alcohol use, which is really quite high. If you look at the first study here at MTRH, the 42% is just alcohol use, not necessarily harmful. But if you look at what we found during the COVID pandemic, was that 44% of healthcare workers had use that is considered harmful to health, use that is considered harmful to social well-being, use that can cause the social dysfunction. So I think that is really concerning. Again, looking at the risk factors for substance use among healthcare workers, male is at the top, and that is consistently seen across the world. What we also saw was that if a co-worker was using substances, then it was likelier for that person to also be using substances. Those with higher years of experience at work had higher odds. Those who reported that substances were easily available in the workplace had higher odds of using substances. Those who were unmarried, divorced, separated, widowed, generally means social isolation. And we find that people who are socially isolated have higher odds of substance use as well. And this we see again in many studies across the world. The study that we did among healthcare workers, we saw that doctors or consultants had higher odds of using substances compared to other healthcare workers. We are not yet sure why. And also those who had about 11 to 20 years of experience had higher odds of having harmful alcohol use compared to those with much more experience or less experience. So these are some of the risk factors that we have for substance use that has been documented in Kenya. So why should we care about substance use? So what? Why should we pay attention? The health impact of substance use is huge. If you think about alcohol, if you look at the global status of on alcohol health and on health related issues as a result of alcohol use, you'll find that harmful alcohol use is a risk factor for multiple diseases, including cardiovascular diseases, digestive diseases, cancers, and injuries, road traffic accidents as well. So it has a very huge health impact. We also see a huge mental health impact from using substances, including suicidal thoughts. Alcohol is associated with suicidal thoughts, both ideation and suicidal attempt. We are not yet able to say whether it's causal, but we know that there's an association similar to psychosis, both alcohol and cannabis, for example, anxiety, cannabis and alcohol, depression, cannabis and alcohol as well. Not to say that the other substances don't, these are the ones that we see frequently. So we do see a lot of association between these substances and these mental health outcomes. Also, alcohol has been associated with increased interpersonal violence. A lot of research done internationally, but also here in Kenya has shown a strong association between substance use and violence in the home and even outside. And in terms of social dysfunction, this is really heavy. I chair the employee assistance program within MTRH, and I see how much substance use, particularly alcohol, which is really common, results in reduced productivity, dysfunction with the family, dysfunction in terms of finances, relationships with workmates. I mean, the impact is very heavy in terms of social dysfunction. But importantly is also that it is costly. A lot of money is lost because of people not being productive. We had in the rehab the other day a young man, a teacher in his late 30s, but unfortunately got Wernicke-Korsakoff during a period of alcohol withdrawal that wasn't managed in a timely manner. And so that memory is totally gone. Cannot remember my name even after 1 minute, So the patient is alive and breathing, but then they are not functional in terms of the ability to function. That is totally gone. The cognitive functions are totally gone. So what happens to that person? What happens to their children, their wives? What happens to their source of livelihood? Are they able to work anymore? Are they able to earn a living? Are they able to contribute to building the country? So those are the costs. In terms of the cost to the healthcare system, you can see how heavy that can be. Premature death as well. So it is quite costly. So that substance use issues do not just affect the individual, they affect the family, they affect the community, they affect workplaces, and they affect the entire society. Again, we did a study in 2020, and we found that for Kenya, alcohol use disorder cost the economy 3 billion Kenya shillings. So that is what we lost because of harmful alcohol use. And you can imagine how, this money can be put into better use. So it is expensive. And when we think about an impaired healthcare worker, we keep on talking every now and then about the way human resource for health is very much constrained. Healthcare workers are few, doctors are few, nurses are few, occupational therapists, the whole, range of healthcare workers are very few in number. And they are needed. Health is a very important service that needs to be offered to the society, to the community. So healthcare workers are very important, and their numbers are already very constrained. So you can imagine if we are having, again, substance use further reducing the number of healthcare workers or reducing their productivity, then it's something that we need to pay attention to. On several occasions, I've been called to check on a colleague who happens to be intoxicated at work, and they're not able to be productive for that day. That means the services that they've offered on that day, you can imagine what happens, okay? Or you can imagine what happens if the medication is prescribed wrongly, for example, or is administered in a way that is not accurate. You can imagine what the consequences would be. So healthcare workers, the work they do is very critical. It requires proper attention and concentration. It requires for the physician to be well, cognitively, health-wise, to be well. And substance use interferes with that. So we really need to pay attention to this problem, And as I like to say, that is why it's all our business, because it just doesn't affect the individual, it's affecting the entire society. I like to give an example of if I would get into a North Rift from Eldoret to Nairobi, and the driver that's driving that vehicle happens to be someone who's intoxicated and we get an accident, then I'd be gone. So it means we all have to pay attention, because we are all affected in one way or another, either directly or indirectly. So what gets in the way of seeking help for healthcare workers? And I think at this point, I'd like to remind us that we are as mortal as can be, and we are human as can be. We are made of the same flesh and blood that everyone else who walks on the surface of this earth is made of. We are not made of metal or stone that cannot be broken down. So we suffer the same kind of challenges that other people suffer. We also suffer from addiction, we suffer from mental health challenges, we suffer from physical challenges, we suffer from financial issues. I mean, all of the challenges that other people who breathe on this earth face are the same ones that we also face. So I think it's important for me to remind us today to acknowledge our vulnerability and our limitation, and that we are just mortal like anyone else, and we can face these same afflictions. And I find that sometimes that is a major barrier to seeking treatment, because I'm the doctor, or I'm the nurse, or I'm the occupational therapist, or I'm the social worker. I'm the one who's supposed to offer help. How can I be the one seeking help? I want to remind us again that let us go out and seek help, because we are made of the same flesh and blood, just like everyone else. And a lot of times that culture of stoicism is what stands in the way. Stoicism really means that, you know, I can do it by myself. It's a culture that says I'm invincible, which is not really true. So let us remember that we are human. Stigma also gets in the way. Generally, mental health, you know, still there's a lot of stigma surrounding mental health and addiction, and, you know, people don't want to be identified as having a mental health condition. We are not yet comfortable with seeing psychiatrists. We are not yet comfortable with seeing counselors. Of course, I must say that the stigma is declining over the years. Over the past 10 years, I've seen a lot of declining of the stigma, but it is still there. So that forms a major barrier. But I think even just remembering that you're vulnerable and you're human and it is okay to seek help is something that can break the barrier. But also in the workplace, having constant conversations about mental health, freely talking about it, you know, supporting staff in the workplace who have mental health issues can help break that stigma. And of course, for addiction is that services are not available. They are still very, very scarce. If you look at how treatment is offered for addiction in the country, a lot of it focuses on inpatient care, and a lot of that inpatient care is offered within private facilities that are not affordable. So very little within the public sector. I'd say maybe 3 or 4 facilities only within the public sector offer addiction treatment. And then treatment is not being offered across, you know, the whole range that is needed. For example, not everyone will need inpatient care. Some people need intense outpatient care or less intense outpatient care. That whole continuum is not available in the country. So, and this is a big problem. Not everyone is able to go into rehab for 90 days. Someone needs, say, a 3 times a week service outside, but we find that outpatient services are almost non-existent across the country. So this forms a very huge barrier. And of course, we continue advocating for investment in substance use treatment. And for each of us in the different facilities that we work, I'm sure that we do have some level of, you know, mental health. We have mental health workers. We could have a counselor, we could have a psychiatrist, few but increasing in number. In those places, let us try and initiate addiction treatment services as much as we can. Let us be the advocates who push and say we want an addiction service in this facility. We now have a psychiatrist, we want an addiction service, so that we're making sure that these services are available to the general public, but also to ourselves. So what can we do within the workplace? We are very keen to know what we can do in the different health facilities that we work in. And again, to remind us here, we all have a responsibility to play. We all have roles to play. I have a responsibility, but we all do have a responsibility to implement some of the things I'm going to talk about. It's fine to say, let the MedSup do it, or let the CEC health, or let the CS, you know, health, whoever it is, serikali ifanye. But my belief is each one of us individually within our small spheres of influence, we can advocate for these actions that I'm going to talk about to be implemented in the workplace. So I've had the privilege to chair the Employee Assistance Program the past maybe less than a year at NTRH. And employee assistance programs are an excellent way for addressing mental health and alcohol and drug abuse issues in the workplace. So this is what I'm going to talk about now, and I'm going to give practical guidelines for how we can do that in the various institutions that we work for. So what is an EAP? I'll call it EAP. So it's a program that offers support, mental health support in the workplace. I think, so this program recognizes that the workplace is where we spend a majority of our time. Really, if you think about it, I'm out of the house in the morning, I'm back at 5. and then in the house, you're really sleeping. So you're spending most of your time in the workplace. That means the workplace is a very opportune place to implement interventions for mental health. But also secondly is that mental health issues and substance issues interfere with workplace productivity. Okay, so very important to have an employee assistance program, and it is a requirement of International Labour Organization. So in Kenya, it's not yet legislated that you must have an employee assistance program within the workplace. However, it is recommended, you know, as good practice to support the mental health of employees in the workplace. So what kinds of programs can EAPs implement? It's really the simple things. Haitaki budget kubwa. I like to say haitaki budget kubwa ya mamilioni and the big tenders. It's just very simple, practical things that can be done in the workplace that don't need too much expertise in order to promote mental health. So for example, routinely educating staff on mental health and substance use. I'll talk about both because the two really, frequently occur together. So it's about educating staff on the harms of substance use. You'll be surprised by how much wrong information is outside there concerning substance use. And I hear it a lot of times with the patients that I see. Like yesterday, a patient was telling me about treatment for addiction, that they have heard that cold turkey is very safe, and that if they were admitted in the ward and they went through detox, that would be harmful and we would lose them. And they were really, really scared. So I had to go through a session of actually educating on what withdrawal means, what happens to the body, and how treatment helps, and then that calmed them down. So generally, there's a lot of misinformation about substance use. For example, how substance use makes you more masculine. It's actually the opposite, you know. Substance use interferes with metabolism of estrogen and androgens, and, you know, actually causes feminization. So a lot of the information out there is not accurate. Or during COVID, like alcohol prevents you from getting COVID. It was quite the opposite. It was lowering immunity. So it's very important to educate. Or like cannabis will make you brighter and pass exams in class. I hear a lot from the teens and the kids that come in, you know, and then now we have to give them the accurate information. So you can do routine education to staff on harmful substance use. There's a lot of literature on the NACADA website that, you know, you can pull and use to educate. You can also educate on strategies to promote mental health. We're going to go through some of them towards the end of this webinar. How to cope better with stress. We've agreed that stress is, without a doubt, a part of life. As long as you're breathing, there's going to be stress. I don't know that there's anyone in this world who has never experienced stress or will never experience stress. Stress and life are synonymous, without a doubt. So that the question should be, so how do we handle, how do we cope, you know? So very important to educate on how to handle stress and general strategies for promoting mental health. Again, this kind of literature can be gotten even on the net. It's very simple strategies. WHO website has them as well, that can be used to educate staff. And then a bit more technical is you can implement screening and brief counseling programs. I'm certain that in many health facilities and institutions across the country, we do have a counselor, and that can be the starting point. I know we may want to say we need a psychiatrist or we need more counselors, but let us start with what we have. Let us start with where we are. Just start small and grow it gradually over time. Instead of waiting to have a battalion of psychiatrists or psychologists before you start the EAP program, just start with what is there. So screening is really trying to figure out who has mental health issues and then sending them for counseling. Okay. So those are the some of the programs we can implement. Certainly testing can be done. Some employee assistance programs do testing for substances. Sometimes that can be done if that's the policy of the institution. For example, in high risk situations, say for example in a medical setting, healthcare setting, you wouldn't want a doctor to show up intoxicated in theater, for example. And if they appeared intoxicated, you may want to test. Okay. Some people do it random, some people do it indicated. I know, like for pilots, it can be done random, and just to make sure you're not having an intoxicated pilot, in a plane. So that can be done. Yes, it can be controversial, but it can be done. And then other interventions that employee assistance programs do are like, other supports. For example, if someone, has gone through a counseling program and you find that they're not able to deliver well at workstation A, you can redeploy them to workstation B, for example. So offering that kind of support is important, and family can be included as well, and other life skills education programs that touch on things like financial education. So these are the different kinds of programs. Of course, I forgot to add that if you have psychiatrists with you, then you could start a staff wellness clinic, like at NTRH. Last year, we did start our staff mental wellness clinic. It's an open place that runs every week, and we allow for staff to walk in and say, hey, I'm having this challenge, please help me. Of course, there are those who are referred by management. A lot of times the route to EAP is varied. It can be that someone shows up and says, I have this condition, please help me. I'm struggling with alcohol or a mental health issue, please help me. Or it could be that that mental health issue led to a disciplinary issue, and so they're referred by management. So sometimes management referral happens top bottom, but sometimes it's initiated by the staff themselves, or sometimes it's initiated also by friends and colleagues. So there are many pathways to EAP, and so referral can happen like that to that clinic that I'm talking about. But of course, NTRH has had an EAP program for more than 11 years, 12 years maybe, and so we've learned a lot as we have gone, and we have grown to the point that now we do have a clinic. But I'd like to emphasize, even if you said we are just starting with educating staff on mental health, Dr. Jaguga, please help us with the literature for how to educate on alcohol and drug abuse, or literature on how to talk about self-care, which is promoting mental health. We are happy to do that. So just start with the little that you have. It may look like you're doing something small, but it's extremely, extremely important. So what kind of resources do you need to implement EAP activities? You definitely need a committee in place, the one that is responsible for, coordinating the program. And NACADA has guidelines for how to constitute one. Also a policy. A policy just describes a set, gives a set of instructions and guidelines for how you're going to run your education program, for when you're going to or not going to allow alcohol in the workplace. For example, in MTRH, we don't allow alcohol in the workplace and at all hospital functions, even when they're happening outside of the workplace. That's part of our policy, to totally discourage alcohol use. Even support by organizations that manufacture alcohol. Again, we do not interact with them, just to make sure that we have a no alcohol policy generally within the hospital. So you can have a policy as well, and NACADA also guides you how to develop an EAP policy. Of course, NACADA focuses on alcohol and drug abuse only, but this EAP policy, remember, you can broaden it to include mental health in general. And then now you can develop the committee can develop an annual work plan for how they will implement the activities throughout the year. So this is really what you need. You don't need too much of a budget to do education. It is not expensive. That is what I would say. It doesn't require a lot of money to implement these simple activities. You do need staff. I talked about mental health workers, but you also need champions and peers. You need people who think of, who have these alcohol issues at heart, people who are passionate about substance use issues, people who are passionate about addiction, and they can, champion for let's say for funding to support a few of these programs, or just to participate in the health education process, and so on and so forth. And peers as well, people who've gone through recovery, they do understand the journey more than we do. It's easy for us we understand the neurobiology and the details of it that we read in the books, but then the peers actually have the lived experience. So it's good to have them on board as well. And having peers also helps to destigmatize alcohol and drug abuse issues. Of course, I talked about a budget. You may have an office or not, depending, and then you need your referral mechanisms laid out, like I had talked about earlier. So as you can see, setting up an employee assistance program is not resource intensive, and my belief is that this is within reach. Okay, we have to think about the work environment as well. How can the work environment discourage use of substances? I talked about no use policies, even at official events that are happening outside of the workplace, so that we are passing a singular message that we are not encouraging substance use in the workplace. More so as healthcare workers, I think we need to pass that message clearly, that we're not going to encourage substance use. Of course, you need management that is very supportive of alcohol and drug abuse issues. I think at MTRH, we have been privileged to have management that is, that understands that alcohol and drug abuse is a health issue and needs to be treated as such. So that is extremely important. Again, NACADA has trainings for heads of department and supervisors. NACADA has done a lot of work in the area of making sure that interventions for addiction are implemented in the workplace. So they are a very good resource. If you think about what programs to implement, how to go about it, you need to look at their website. So very important to have management that is supportive. And of course, we need favorable work schedules that allow for time to rest. Okay. Also to discourage, in order to improve overall mental health in the workplace, and remember we said mental health and substance use are very much related. You need an environment that is characterized by trust, honesty, fairness, and respect. If healthcare workers feel disrespected in the workplace, then that's a workplace that is encouraging mental health issues and substance use. There needs to be fairness in terms of opportunities, in terms of how punishment is meted out, for example, or how reward is done. It has to be perceived that there's some level of fairness. If there's favoritism in the workplace, then it's very discouraging to staff and can cause mental health issues. It's very important for roles and responsibilities to be communicated clearly. If staff are not understanding what is expected of them, if they are not being involved in discussions about, about decisions that are being made in the workplace that concerns them, then that affects their mental health. Okay, so generally you need an environment within the workplace that is supportive in order to promote mental health issues and prevent use of alcohol and drugs. Okay. So how can I promote my own mental health? Remember, we said we all have a responsibility to promote our own mental health and avoid alcohol and drug abuse. Let us take time off for rest, okay? As healthcare workers, we are used to giving and working and not thinking about taking a break. We are not taking meals in the middle of the day. You're not taking a break to go to the restroom. Let us take time off for rest. Let us take time off to go to the loo. I know it sounds funny, but we're not taking time off to even go to the loo, and we're holding on to our bladders and getting UTIs. So please, let's take time off to rest and do the things that we need to do. Let's make sure we're getting time to sleep. Let's make sure we are making time to eat. Make time for the things that they value. It can't be that we are too busy to even get time to, to have a snack or have lunch. Let the patient wait briefly, go and have your meal, and then come back again. You're no use to that patient if you're not functioning, your blood sugars are low, you're not thinking straight, okay? Let's take time for leisure. Let's have hobbies and a life outside of work. For a lot of us, our identity is really work, we are who we are synonymous with the work that we do. So it's very important for us to separate those two things, so that you make sure you're still Dr. whoever, but you're also still Mama or Baba whoever, but you're also still Kamau who loves to play golf, for example. Make sure that all of those different identities are developed, so that when one is lost, like a job, it doesn't crash, it doesn't go away with your whole identity. Things like practicing gratitude. And these things that I'm listing here, actually WHO says these are the most important in terms of promoting mental health. Thinking about investing in mental health, this is really the most important. Very little investment should go to big hospitals, like a big Mathare or a big mental health unit, for example. Very little investment should go into that. A lot of the investment in terms of mental health and addiction treatment should go into informal support, self-care, and then community-based care, in that order, and very little within hospitals, meaning we want to do what is recommended is a lot of preventive work. A lot of the effort should be put towards prevention and promotion of mental health. So this is what we are listing here. Practice gratitude. Think about the positive things that happen in your day. Make sure you're doing at least one thing that you enjoy every day. It helps to give you positive emotions. Doing something that makes you feel achieved as well is important. Regular exercise, making sure that you have a social support system. Sometimes with a lot of work and getting deeply involved in work, we lose family and we lose friends. So extremely important to have a social support system. Set realistic goals. And I really like to say this one for healthcare workers, especially for doctors. I know I talk a lot about doctors because I'm one myself, but a lot of times we set goals that are not realistic. We set goals that align with someone else. So because someone else went and did a fellowship, for example, in neonatology, I guess, and so I have to do it. Okay, but that's not your goal. It's not even your interest. You're a fish getting into monkey business. So make sure that you're doing things that really align with your skills and strengths. You can't be a monkey and you're competing with a fish in swimming. It cannot work. Or you can't be a fish and you want to get out of water and get into a tree climbing competition. It cannot work. So set goals that really align with your own skills and strengths, and to really avoid peer pressure. It can be strong, especially among doctors. I've seen it, and it's a source of mental health issues and frustration. Practicing spirituality is extremely important. It's practiced in different ways. Some people practice it by, through religion. Some people practice it through altruism. Some people practice it through, different ways, believing in different things, So however you view spirituality, practicing it in the way you understand it promotes mental health. And of course, avoiding alcohol and drugs. So these things promote mental health and help us stay away from bad coping things like using alcohol and drugs. So overall, addressing substance use requires approaches that target the individual, what we've just talked about last, but also the workplace environment. We've talked about how the workplace environment should be like, and we've also talked about the employee assistance program that we can establish in the workplace. So future directions, we need to do research that tests, interventions that target healthcare workers. We did a systematic review, I think last year, and, we found that a lot of epidemiological work has been done on substance use across the years, all over the country. But then we are not seeing studies that have tried to test interventions for the different populations, like youth and adolescents, like healthcare workers. We are not seeing that kind of research. So for the researchers who are here, let's try and develop and, adapt and test more interventions that target healthcare workers. We could also develop mHealth interventions, web-based, that is going digital. A lot of times we are very, healthcare workers are very, private and want confidentiality. And, a web-based intervention also affords that confidentiality and privacy. And of course, we need for more rehabilitation centers to be accredited by NHIF, and of course, more rehabilitation centers to be established across the country. So we need for each and every one of us, the 652 of us here today, we need each of us to be advocates for mental health and addiction in the different places that we work in. Okay, these are places where you can seek help. Again, NACADA has a hotline. It has listed all the accredited rehabs in the country, including those that have NHIF accreditation. And then those 3 are the public sector rehabilitation facilities that people can go to. Okay, so we've really come to the end. I'd like us to move to the discussion session. I'll hand it back to you, Christine, to take us through the next session.
Thank you, Dr. for the wonderful step-by-step comprehensive breakdown of the topic. And I'll just go direct to the questions. So there are a couple of people who are concerned about CPD points, and they'll be sent to the email used to register for this CMA in about 1 to 2 days. And then the recording will be uploaded to the KMA YouTube page, so you can find it there. And then I'll summarize the questions in the question box. And I see a few hands up. So the first question is, has the panel ever assessed the impact of seniors on juniors under them during undergraduate and postgraduate training that puts pressure and trauma on them, pushing them into alcohol and drug abuse to cope in the system? Should healthcare workers be compelled to attend a unit on life skills or coping as a part of their training? And then I see another question by an anonymous attendee who asks, kindly repeat and advise employer roles on healthcare workers. I think you can find that in the recording. So is disulfiram used nowadays? And then there's another question about when a healthcare worker goes to rehab, is a government employee, are they given sick leave? And is there any financial support towards the cost of rehab? So the anonymous attendee is still asking about how effective has the mental well-being clinic for staff been at MTRH, and what are the rates of self-referral? And then Ann Boga asks, what are some of the forms filled by rehabs so NACADA can collect data? And then Vincent Oyego says, it's a good presentation. So I can let you answer those ones, and then
yes.
Yeah.
Yeah, I guess you can. And I see we have exactly 10 minutes, so I'll try to be very brief and quick. About seniors to juniors, when we've had these discussions, this has come up time and time again about the manner in which, so juniors are complaining about the manner in which seniors are treating them. I think I'd like to encourage the seniors to take on a mentorship role and mentor the young colleagues, the young healthcare workers, the young doctors. Use language that is appropriate and encouraging and language that builds. Personally, I don't believe that people learn in an environment that includes harassment and frustration. In any case, it does the opposite. So as seniors, to make sure that the environment is one that encourages people to learn and one that is nurturing. Healthcare workers to be compelled to attend life skills training. Yes, I think that's an important future direction. See as much as possible how life skills training can be incorporated into the curriculum for all healthcare workers. Make it a part of mandatory training. The way you have communication skills in the beginning in first year, maybe have something similar. But in the meantime, we are happy to implement life skills training programs for students already. Like I work in MTRH, so Moi is nearby, and that is something we are actually having a discussion about today with my colleagues who we work with in the AMPATH mental health program. And we are thinking of rolling out a life skills training program for students within the university as well. And this can be replicated in other places. For example, UON. Disulfiram is still used. Financial support for rehab. So payment for rehab can either be out of pocket usually, or if you have insurance, then it should be able to cater for that, like NHIF does cover that. So we encourage people to enroll for NHIF, even though a lot of times you find that NHIF doesn't reimburse the whole cost. So it's definitely still a challenge. We need for more facilities to, first of all, to be NHIF accredited, but also we need for NHIF to be able to reimburse a full amount. I know we've advocated for that, but it didn't yet happen. So I agree that payment for rehabilitation services is a challenge and actually limits access to care. So a lot of employees are actually given time off without penalty to seek rehabilitation treatment. So I've seen a lot of workplaces supporting their staff in that manner by actually giving them time off, and they're still earning their salary to seek treatment. Someone asked about, I forget what this is, or something about there's a question about something being effective. I didn't write the whole question. What was it, Christine? Okay, Christine, I think you can move to the next set of questions. I think I'm done with what I had on my list.
Okay, so the question about the clinic was if the staff clinic has been effective.
Oh yeah, very good question. How are we measuring effectiveness? For us, for now, it's been a year. If people are showing up, if people are actually coming and saying we want help, I think we've met our goal. About thinking whether the mental health outcomes are better, that would be a longer term study, very complicated by many factors. But for me, just thinking about the fact that we were able to open it and make it up and running, and that we were able to have people walking in every Wednesday, those who've been referred by management, but also those who are coming in and saying, hey, I need help. I think that's a step in the right direction. And also that heads of department call in and colleagues call in and say, I have a colleague who's struggling. I know they need help. Already there's an environment that acknowledges that mental and alcohol and drug abuse issues are health issues, and that people need to seek the care of psychiatrists. So I already see early success in that sense, that the attitude is changing and that people are actually showing up and sitting. And people know it's Dr. Jaguga in there, psychiatrist, or Dr. Edith Koba that I work with, but then they're still sitting out there and waiting to see us. I think that is success, in that sense. Okay. Christine, we can do one more round.
So
we have 4 minutes.
Yeah, let me find one more. So let me ask this one for, is there a validated tool for self-assessment for addiction as a first step before seeking medical help?
Yeah, very good question. There are tools that can be used and you can use them by yourself. They can either be administered by a healthcare worker or you can use them by yourself. Like for alcohol, we have one called Audit. Audit is AUDIT. There's even an, if you just Google Audit, you can get an online, tool for it, the online version. There's also the PDF version, and also Assist. Assist screening tool also can be administered by a healthcare worker, but you can, get the PDF version, print the paper, fill it out for yourself to see how things are going. There's also the Cage for alcohol. Yeah, but I'd say for now, Audit for alcohol and then Assist for alcohol and all other substances. But there are several others.
So I've seen one more here that I think would be important. It's asking, what advice do you have for those unemployed? Because it's really tough.
It's tough. Yeah, I can only imagine, how tough it is for those who are unemployed. I was talking to an intern today when he came for me to sign off his book, and I was telling him not to give up. And I was telling him that when one door closes, several others open. I know I come from a place where I was automatically employed with my colleagues, and we may not truly understand how difficult it is. But just to encourage the young ones, it's not the end of the world, and there are many other doors that we can knock on. If door A is not opening, then knock on door B. If door B is not opening, then try C and try D and try E. And have a spirit that says you're not going to give up, and have a spirit that is open and willing to try multiple different things, so that if automatic employment is not working, what are the other potential solutions? How can we come together as a group, open a practice, for example, and make money out of it? What are the other options? We like to say in mental health, don't get stuck at option A. What are the other options? Okay. But also for the other colleagues who have access to jobs, access to locum, let us also support the younger doctors with the opportunities that we have as much as possible. So the older doctors to support the younger ones, but also the younger ones to have a spirit that says, I'm not going to give up, and I'm going to try. I'm going to try as hard as I can. I'm going to try the different options, not losing hope.
I think, Doc, we can close now.
Okay, yeah, I see it's time. It's 7:59. I think I'll give my parting shot and then we close. I think I'd like to say that, I need to take action, to address alcohol and drug abuse issues, but you also need to take action as well. And we all need to take action in order to make sure that we are tackling this issue of alcohol and drug abuse, and we all have a responsibility. So thank you so much, and feel free to reach out. I should have shared my email, but feel free to reach out if you. Oh, I see a chat from Dr. Simon. Sorry for winding it up. Dr. I'll let you come in at this point. But before he does, please feel free to reach out if you need any information related to setting up employee assistance program. My email is flokemboy@gmail.com. I'm happy to assist. I'll hand it back to you, Christine, to invite the KME chair.
Thank you, Doc. It was a nice presentation. So now I'd like to invite Dr. Melanie, who is the chairperson, for the KME Physician Wellbeing Committee, who will now in turn invite the president. Thank you.
Thank you very much, Dr. Soy and Dr. Jaguga. That was a very good presentation. And thank you everyone who has participated this evening. A very impressive attendance. I would like just to remind you that every Tuesday we have this webinar ongoing on mental health issues amongst healthcare workers, and we'll continue to bring you more interesting topics in relation to this. Further to that, as you can see, what we've displayed on the screen is the numbers that are there for us to call. Should you have any problem or need any assistance, we have a call center that is currently ongoing. And also finally, on Thursdays, every Thursday afternoon from 2 p.m., we have a debrief session. And this Thursday on 9th, we will have a debrief session for doctors. We will send around the registration link. Kindly join in so that we can talk to, listen to the clinical psychologist speak to us about how we can manage some of the things that we handle while at work. Thank you, everybody. I acknowledge the presence of all members of the Kenya Medical Association, fellow well-being members, and also Dr. Koba. I acknowledge your presence. To wrap up the session, because of time, I will call Dr. Kigondu. You can give your brief remarks as we wrap up the webinar. Thank you.
Yeah, thank you very much. Actually, Diana Marion will wrap up. I just wanted to make a comment on the session, and I want to thank the speaker very much for very, very excellent presentation. In their areas of work, health workers are in need of a lot of the programs that she has actually said. I come from a background of having been educated by my wife, actually, who runs a rehab, and we have taken care. She has actually taken care of a lot of health workers, and the presenters in terms of what I have learned looking from the sidelines, because I cannot handle that kind of work, was that early rehab is very important, especially for healthcare workers early. So it is important to identify health workers who may be going off the cliff and get them have rehabilitation early before. And this has worked a lot for a lot of health workers. So with that, I would want to welcome Dr. Diana Marion and thank all of you and all the associations involved here and the union for making this a very successful webinar. Dr. Diana Marion.
Good evening. Thank you, President. You've broken protocol, so I think I'm not going to say much. The President should be speaking last, but all I can say is that I want to thank the team for a very well-organized presentation, very informative, very simple for all of us to understand, and actually giving solutions at the end on where we need to all seek help. I would like to maybe just put the Physician Health Committee also up to task as we continue developing topics for this. What is the role of the immediate family and maybe even spouses in making the situation worse or better for drug dependency? I think it's something we can also think about. Otherwise, thank you very much. May you all have a good night. Thank you.
Thank you, everyone. We can close now. Good night. There is we have a feedback link that you can use to share your feedback and any topics that you'd like for us to address. Thank you and good night.
Thank you. Bye-bye. Good night.